This one. Good afternoon and welcome to the finals of the Professor E.T. Selvam quiz. I am Dr. Akshay Nair. I am the quiz master for today. Earlier in the day we had a prelims round, the preliminaries, where from 28 teams that participated, we selected the top 5 teams who've come in and qualified. It was a very close fight with basically just 3 points differentiating the top 5 teams. And we have 5 all-women team who have qualified for the finals. So I'll invite our team members to come on stage, on here below the dais. We have 5 chairs that have been created, each for each team. That we'll be also giving you buzzers as well as mics for you all to answer. We have multiple rounds that we will be going through, and as we go through the rounds, we'll explain the rules for each of those rounds. Right. So the 5th place team that qualified was Dhanalakshmi Srinivasan Medical College and Hospital, Perambalur, Dr. Ramya S. and Dr. Ramya Priya. Can I ask them to join us here? And there are 5 team spaces here and they can choose any one of them. The 4th team is from Government Rajaji Medical College and Hospital, Madurai, Dr. Reshma Vikram and Dr. P. Suganya. The next team is from Arvind Eye Hospital and Postgraduate Institute, Coimbatore, Dr. Abhisha and Dr. Anusha Prasad. I'll go first, is it? The next team is Southern Railways Headquarters Hospital, Chennai, Dr. Subita and Dr. Archana. And finally, Indira Gandhi Government General Hospital and Postgraduate Institute, Pondicherry, Dr. Aishwarya and Dr. Sharanya. They can come up and take the only remaining slot, that is Team A. All right. So each of y'all have a mic in front of y'all. So I think y'all should take that mic and keep it with y'all, because your answers have to be loud and into the mic. So everyone out there right at the end of the auditorium can hear your answers. All right. So are we ready? Can we go over the rules briefly once? Okay. So The rule of any quiz is always that the quiz master is always right. These are questions that we worked over, sourced from different places. There may be one or two small errors which may happen, but the answer shown here is considered to be the right answer. This is not just a bookish ophthalmology quiz. This is ophthalmology plus medicine plus a little bit of non-ophthalmology trivia and non-medical trivia. There are different rules with variations, and each of those rules of the rounds I'll explain as we go along. And as always, if you have any doubt, we'll go back to and refer to rule number 1. All right. We also have our quizzers, our scorekeepers with us here who will be helping us with keeping scores throughout this quiz today. Thank you. So we start with the first round, and this round is called, we call it infinite bounds. So I'll explain the concept of infinite bounds. Is that when I give, say team A gets a question, and if they answer it, they get plus 10. There are no negative marks if you give a wrong answer. The next question then goes to team B. Now if team B doesn't answer, the question passes to team C. If they don't answer, it goes to team D. But if team D answers it, the next question then goes to team E. So that way, there is an equal distribution of questions, and one particular team doesn't keep getting questions, and questions keep getting rotated throughout, and the probability of a team getting repeatedly difficult questions is all eliminated. So this is a standard that is used in quizzes globally. It's called the infinite bounds. The level here is going to be basic. It's not going to be too high. As we go along, the level of questions will increase. Just be patient, and audience, I know you may be excited, but do not speak out the answer if you know it, because we want the quizzers to win it for themselves. With that, we'll start with the first question of the first round. All set? Can we have a round of applause for the teams that have come into the finals? Thank you. All right. So, team A, this is your question. With this fundus picture, give me your diagnosis.
Central retinal vein occlusion.
Central retinal vein occlusion is correct. So, as we said, we are starting slow and simple. A round of applause for them. Team A gets plus 10. All right. So, since Team A has answered that, the next question goes to Team B. Team B, a couple of years ago, this was a Google Doodle. Who's featured in the Google Doodle? And also, if you can, give me the date, but no extra points for the date. But tell me, what is this Google Doodle supposed to commemorate? The audience seems to have already got it, but please do not answer it loudly.
A. Govindarajan, sir.
I'm going to pass to Team C. They don't have an answer. Team D.
Dr. G. Venkatasamy.
Dr. G. Venkatasamy.
Is the founder of Aravind Eye
I know,
Hospital.
but what was it supposed to commemorate?
On his birthday.
We'll give it to you. It's his birthday. That's correct. Plus 10 to Team D. Team D is the team from? Aravind Eye Hospital. Yeah, well, if you had got this wrong, I don't think you'd be going back to the hospital. Right. So this was on 1st of October. It was Dr. G. Venkatasamy's birthday. We wanted the exact name, so I can't give that points to Team B. Plus 10 to Team D. And the next question goes to Team E. Team E, based on this imaging finding, what would be your first differential diagnosis? You have roughly about 10 seconds to answer, so.
Retinoblastoma.
You don't have to be so worried. It is retinoblastoma. Intraocular calcification in a CT scan is most likely retinoblastoma, especially with the configuration that we saw. So plus 10 to Team E, and the next question goes to Team A. Team A, this is a particular mode of imaging that you see. What is it called?
Fundus autofluorescence.
Fundus autofluorescence is the right answer, plus 10 to Team A. And the next question goes to Team B. Team B, this is a fundus picture of a patient. Can you give me your diagnosis?
Optic nerve avulsion.
Optic nerve avulsion. They have avulsed the answer out of this question. Plus 10 to team B. And the next question goes to team C. Team C, based on this fundus photo, what would be the name you will call this?
Morning glory syndrome.
Morning glory syndrome or morning glory disc is absolutely correct. Plus 10 to team C. All of them seem to be answering everything correctly. The next question goes to team D from Arvind. This is an MRI. What is your most likely diagnosis in a child with this clinical MRI picture?
It's the fusiform enlargement of the optic nerve suggestive of optic nerve glioma.
They've done better than the radiologist. That is the correct answer. Fusiform enlargement of a nerve in a child is most likely optic nerve glioma. So team D have got plus 10 and we go to team E. Team E, this is an unusual picture. Why does this typewriter have only 7 keys on it?
Like a Braille system for blind.
It is a typewriter for typing the braille letters. Absolutely correct. Team E have got that very well thought out and worked out. Plus 10 to team E. And we've completed one round of everybody answering their direct questions. Well done. I think the last question of this round, or the one but last, goes to team A. What is the classical description of this anterior segment photograph in a patient with recent trauma?
8-ball hyphema.
8-ball hyphema is absolutely correct. That ball has been hit out of the park. Plus 10 to team A. And team B, this is your question. Peter Ebdon is a professional snooker player and a world champion. Sometimes in tense scenarios, he goes to the referee for asking for help during the game to overcome an unusual and awkward handicap. What is his problem? Team B passes. Team C.
Colorblind.
He is colorblind, so he asks the referee for help during a game and he's a snooker champion. Absolutely correct. He is colorblind and sometimes he has confusion between which ball to hit, and Peter Ebdon has been a world champion 3 times in spite of his color blindness. So very well worked out by team C. They get plus 10. And if we give some time to the scorers to tally up at the end of round 1, we'll then go and discuss, we'll have the scores. Meanwhile, for the audience, he is the only ophthalmologist that you can see across in one of the Madame Tussauds wax museums. Any idea who he is? Who? Any guesses? We're not familiar with the face, but who do you think would be an ophthalmologist of the stature who would be included in Madame Tussauds Wax Museum? It is Sir Harold Ridley, the inventor of the intraocular lens. And I think we have the scores ready. So team A has 30. Team C, D and E are tied on 20 each, and team B is currently in last place with 10 points, but there are enough opportunities for you to make up and take the lead. Alright, so now again we start off with some infinite bounds, and this time we start with team team E to get the first question, and then we go again in the clockwise way. But again here the questions are slightly more difficult, so we are going to get plus 15 for every right answer. No negative marks though. There are going to be 10, 12 questions again in this. So team E. No, this is a new round. So we go in the opposite direction. Plus 15, so team E, this is for you. Based on this fundus picture, what syndrome would you suspect in a patient? Wyburn-Mason, is that a syndrome that we only read of but never see? Absolutely correct. Wyburn-Mason syndrome is the right answer. And since E have answered that, the next question goes to team D. Team D, which chemical found commercially available in mouthwashes is sometimes used to treat acanthamoeba or bacterial keratitis? 3 drops to 1 bottle of artificial tears.
Chlorhexidine.
Chlorhexidine is the right answer, plus 15 to team D, and these guys seem to be knocking it out of the park in every question. Team C, this is your question. Now, see this instrument carefully and give me the name of this instrument that is used in the clinic.
Ludell's exophthalmometer.
Lude's exophthalmometer. I'm going to take a pass around and then come back to you. Team B, do you have a better answer? No. Team A? Team E, do you want to take a try? Or team D?
It is Lude's exophthalmometer.
Lude's, I'll give that, but I'm going to give plus 10 to team C, not plus 15. The answer we were looking for is double Lude's, because a Lude's is just one bar that is kept on the canthus. This allows bilateral simultaneous examination of proptosis on both eyes, so it's called a double Lude's. So we're going to give only plus 10 to team C, and the next question goes to team B. Team B, based on an imaging modality, you've seen this picture, someone has WhatsApped it to you. Hey, my brother's report. What is your diagnosis?
Optic disc drusen.
Optic disc drusen. Can you tell me what imaging is this again?
Autofluorescence.
Autofluorescence is correct. So plus 15 to team B again here. All right, team A. This is a 17-year-old boy who's gone for a regular checkup. Both eyes 20/20, N6, in pressures are normal. But you've seen this fundus picture. What would your next investigation be?
CHRP and OCT, sir.
OCT for what? What would you look for in OCT?
It's congenital hypertrophy of the RP.
Congenital hypertrophy of the RP. So OCT will tell you. So if you think of an investigation, you need to think of what happens if that you see that investigation or something comes out positive in that. So I'm going to go to team E.
Colonoscopy to see for polyps.
So you see CHRP in the eye and you want to go up the other end. Colonoscopy.
Colonoscopy, yes, sir.
Wow. Do you think the patient will agree and come and tell you, I came for an eye checkup and what do you want me to do? Well, I'll tell you what I want to do. I want to give you 15 points because colonoscopy is the right answer. Congenital hypertrophy of retinal pigment epithelium is associated with familial adenomatous polyposis. Absolutely correct. That's a great question, worked out very well by team E. You get plus 15. The next question goes to team D. Now, this is again a fundus picture. We've had lots of fundus pictures coming your way. For a full 15 points, I need 2 systemic conditions that you look for in a patient with this. You can name any 2. Don't tell me what the diagnosis is. Tell me what systemic associations or systemic conditions would you look for.
Sir, syndrome we have to tell.
No, not the syndrome. This syndrome will have multiple systemic associations or systemic lesions. Name 2 such lesions.
Pheochromocytoma, von Hippel-Lindau syndrome. We have to look for pheochromocytoma. Then cerebral hemangiomas.
Okay, I think we have enough. The first 2 itself are correct. A big round of applause. Von Hippel-Lindau syndrome is the right answer. Multiple lesions are seen, including cerebellar hemangiomas, hemangioblastomas, pheochromocytomas, RCC, pancreatic cysts, endolymphatic tumors, and cystadenomas of the epididymis. Plus 15 to team D, and team C, this is your question. Now the question is just 2 images. One image is that of a gentleman and the other is of some finding. And there is one word that links the 2.
Sir, Khodadost.
Khodadost is the right answer. That's Dr. Khodadost, the corneal surgeon from Iran. And here you can clearly see what is known to be the Khodadost line or rejection that you can see that's growing across the corneal endothelium there. Khodadost is the right word. Khodadost line was the key that we are looking for. Plus 15 to team C and team B. This is your question. This is a fundus photograph. It's not a painted picture. It's an actual photograph. What would be your differential number 1 in this case? It's a tough one, but we have gone to the next level of round, so try to give it a shot. All right, we go to team A. There are no negative markings.
Prominent vortex veins are visible, sir.
All right, team E, do you have an answer? No. Team D?
Gyrate atrophy.
No, that's incorrect. And team C?
VKH.
VKH is incorrect. It was the answer we were looking for was birdshot chorioretinopathy. So since team B, well, this was the question that you got directly. The next question again is to you. Since no one answered this, what's this gentleman's name? And for extra clarity, why is he featuring in a quiz that we are talking about? All right, we go to team A. Team E.
E.T. Selvam.
E.T. Selvam. Which college y'all are from? The faculty need to note that. They've called him as E.T. Selvam. Team C, Team D? No. And Team C is not taking a chance. Anybody in the audience? Mansukh Mandavia, who's the Union Health Minister. A round of applause for yourself, sir. He is the current health minister, and it's important that we know who's the man who's landing us in trouble. So for the third straight question, team B, this is your question. This unit is equal to the median lethal dose of the amount of intraperitoneal injection needed to kill 50% of the mice of this particular weight. What chemical compound are we talking about? So 1 unit of what chemical compound is the median lethal dose that is injected intraperitoneally in a number of mice, and once it kills at least 50% of that mice, it is said, okay, this much amount that we have injected is 1 unit of what drug? Okay, team A.
No negative marking. Tuberculin unit.
Okay, team E. Team C seems, team D seems to have.
Botulinum toxin.
Botulinum toxin is the right answer. Plus 15 to team D. 1 unit of botulinum toxin is equal to the median lethal dose or the amount of intraperitoneal injection needed to kill 50% of the mice that are injected with this. Botulinum toxin is the right answer. Team D get 15. So team C, this is your question. We are talking about an organism, microorganism, which was first written about by an Italian priest. He named this organism as a holy water sprinkler because under the microscope it resembled a holy water sprinkler. This is a holy water sprinkler, the one at the bottom, this one. And when used, it looks like this, right here. So what is the organism that this Italian priest saw and gave it the name? This question is for team C.
Fusarium.
Is incorrect. Team B. They don't have an answer. Team A doesn't have an answer. So when the past question comes to you, you've got to give me the answer immediately because you had the same amount of time as the first team has to think. Team D.
Treponema pallidum.
Treponema pallidum is incorrect. Audience. Aspergillus. This is what aspergillus looks like under the microscope. And this is the sprinkler that he was referring to. And that looks exactly like that. Aspergillum is the name of a holy water sprinkler that they use. And aspergillus was the organism that they saw. So team C, the next question is also to you. Now this is a paper, the audience may not be able to read it clearly, from 1922 in a medical journal. It talks about a new eruptive fever associated with stomatitis and ophthalmia. This is basically a group of children in whom they saw an eruption-like lesion across the skin, the eyelashes, the eyelids, and stomatitis around the mouth, and also associated with ophthalmic inflammation. The eyes are swollen shut, the lips and the lids have crusted blood. I have blocked the names of the two authors. Can you tell me the names of the two authors based on what I told you about this paper? I think this question is for team C. I'll have to move to team B. Team A. No negative points. Team E. They don't. Is wrong. Team
Stephen Johnson's.
Stevens and Johnsons. That's a brilliant answer. Team Arvind, Team D are cracking this. This was the first group of patients with eruptive stomatitis and ophthalmitis seen in cases in 2 children that was reported by Stevens and Johnson. And as we know, this lesion today is Stevens-Johnson syndrome. I'm not going to go into the scores now. I'm going to go to the scores after this round. One question for the audience in the meanwhile. This software developer created a portal and he couldn't decide on the theme color. Finally, he chose blue because it appealed to him most, also because he was red-green colorblind. Who is this web designer? Mark Zuckerberg, and that's why Facebook has a theme of blue, because that's the only color he can appreciate. All right, so the next quiz, next round, requires a pen and paper for the audience, for the team members. I need them. Do you all have a pen and paper with you? We'll just give out a pen and paper to all of you all. Yeah. So in this round, what we're going to do is, this is a little unusual round. It's called progressive hints. So in this round, we'll be giving you one hint of a question. If you think you know the answer to what I'm talking about, you can raise your hand or press your buzzer or just raise your hand and write down the answer. Don't shout it out, because by shouting it out, the others don't get a chance to answer. I'll come to your table and see what you've written. And if you've got the correct answer after the first clue, you get plus 15. But if it's wrong, you get minus 10. And then we move on to the next clue. Now, if you get the answer at the next clue, you raise your hand, write down the answer, I'll come and see. All 5 teams could also raise your hands. I'll go to all 5 teams, see the answers. And if, again, if someone gets it right, they get the point. If someone gets it wrong, they lose the points. We go on to the third clue. At the end of the third clue, if someone gets it, they get only plus 5. There are no negative marks. So raise your hands and write clearly whatever answer you get. So for example, connect this. So Time magazine named her, this is a trial round, so don't worry. Time magazine named her one of the most influential people in the world. She received the Padma Shri award, and she also won the Miss World crown 20 years ago. So take a guess. This is a trial round. You can take a guess. I'm not going to lose points for you. So if you know the answer, all right. So what would be the answer you would give me? Don't give me, but okay, just write it down. I'll come and see. Okay, so she's written an answer, and she's written Aishwarya Rai, so she would lose 10 points. So this is your next clue. In an American TV drama thriller, she plays the role of Alex Parrish, an FBI recruit. Okay, so now what would your answer be? Speak it out. Priyanka Chopra. So now you would get plus 10 and no negative markings. All right. And then for the other three teams who've not answered, the third clue is she's the lead actress in many remakes of Hindi movies like Dawn, Zanjeer, Beva or Chagnipad. And then you know the answer is Priyanka Chopra. So this is generally the gist of the round. It's a progressive round. The first cue obviously will be a little difficult. And then we go down. Raise your hands. Remember, there is negative markings. All set? First question, connect. Your first clue is this gentleman who is a German ophthalmologist, lived in the 19th through the 20th century and has named eponyms on his name in glaucoma, in trauma and in corneal lesions. And this is his photo. Anyone wants to take a go? I can understand this is a difficult question. All right, so we move to clue 2, which is plus 10 or minus 5. Now you see this visual field lesion, and we marked out one particular color, pointing out to something. So all right, so team A for team A has written an answer, and they lose minus 5. That's the wrong answer. They also lose minus 5, and you had raised your hands, and team C gets plus 10. All right, so now the third clue is open only to teams D and E. Your clue is this. All right, can you write down your answer for me? Yeah, so team D gets plus 5. And does team E have an answer? They don't have an answer. It's an incorrect answer. So the answer we were looking for is Seidel. Seidel's test, Seidel's scotoma, and the photograph of Hans Seidel. So well done to team C. They got it in the first attempt, and the other two would lose points, but then they got some of it back. All right. So our next question is this. Connect. This is the photograph of an Italian anatomist who studied in depth the ear, namely the eustachian tube and the aortic valves and circulation, but has a significant contribution to ophthalmology by way of having studied the physiology of how the ear and the eustachian tubes work. Anybody wants to guess for plus 15 minus 10? No one? Playing it safe. Next, these are his hand-written drawn diagrams where he has written how exactly the eustachian tubes open and close with changes in intrathoracic pressure. And he's showing how it works in these pictures in his drawings right from the 18th century. Does anybody still have his name? Okay, so for plus 5, this is your last clue. All right, team A gets plus 5. Do you all have an answer? Do you all have an answer? No. Okay. Team E has an answer, and they have plus 5. So the answer that team A and E have written is Valsalva. Valsalva is the right answer. The anatomist's name was Valsalva, and he was, even though he had a greater discovery in ENT, Valsalva retinopathy is because of changes in the pressures that we get. All right, next question is to connect this gentleman and something that we are seeing straight across the screen here. All right, so team A, C, and D have raised their hand, and team A gets plus 15. Team B has written something, I can't read it, but I know it's the wrong answer, so they lose 10. Team C get plus 15, and Team D also get plus 15, and Team E hasn't ventured. So we move to the next clue here, which is a surgery that bears this gentleman's name, which is where an incision is made 4 mm behind the lid margin to transplant the dystrichiatic lashes to a posterior point by doing a lid split. And this is a surgery that is used to treat the lesion that we saw there. And this is called excis surgery. So I think the team B, D and E have this open for you all. No, you all have got it right. So team B and E. No one? All right. How about third clue? Okay, team E seems to have raised their hands. Let's see what you all have gotten right. They get +5 to team E. Team B, are you getting back some of your points? They are getting 5 points back. So all teams have answered that. The answer is Arlt's line, Arlt's triangle and Arlt's surgery. Carl Ferdinand Ritter von Arlt. I'm glad we know him only as Arlt. That long name would have troubled us. Right, so the next question. Connect. This is a tough one, but it's okay. Dash is the name of a place, was the name of an open ground near the edges of the city of London, lying adjacent to its northern wall. It is known for its marshy conditions, the result of the defensive wall which acts like a dam. So there's a dam, there's a waterway somewhere near London, and the name of the place is what we are looking for. All right, so no one risking 15 and 10. This is a 17th century map showing where this place is, and I've just put a symbol of that place there also. Anyone for +10, -5? Some people in the audience are mumbling the answer, they've got it right. There's a little clue here also. So for +5, the name of this place refers to a piece of uncultivated land which is covered with grasses. And in this place, the nature of this land persisted, although the drainage was put. And an extra hint, the name comes in The Hound of the Baskervilles, which is a book written by Arthur Conan Doyle, an ophthalmologist, about Sherlock Holmes. This place features in that book. Okay, so team D for 5 points have written something which is in the wrong country altogether. And they have also gotten it wrong. So nobody's losing points. The audience? All right, so the answer we are looking for is Moorfields. Moors is the name that comes from an open wetland where Moorfields used to be, and that's the symbol of Moorfields which we had put in there. I agree, this was a little tough one. So this one's on me, sorry. Okay, so connect. The next one, dash. This word refers to a Roman soldier who was in charge of 100 other subordinate soldiers. Hundred other subordinate soldiers. Okay. So no one for +15, -10. Dash syndrome is called so because of the similarity of the nasal structure between the patients of this syndrome and the description of the Roman warriors that we can see from these old, centuries old statues. We've basically given you the answer. Anyone for +10, -5? No? Okay. So, if with the third clue we don't get the answer, I'll stop the quiz right here. This system has active sentry technology, which is the first and only handpiece with a built-in pressure. This helps produce surge and maintains the stability of the anterior chamber by adjusting IOP fluctuations. It allows surgeons to operate at lower, more physiological intraocular pressures. Team D, thank you for allowing me to continue the game. They get +5, and they also get +5 to Team E. Audience? Centurion syndrome, a Roman soldier who leads 100 men, centurion is his name. Centurion syndrome is because of the wide nasal bridge, and centurion vision system is Alcon. No financial interest, I wish though. All right, I think this is the last connect question. The etymology of this origin of the word suggests that it came into usage around 19th century. It is the Latin word for nipple. And we are talking about ophthalmic terms here. plus 15 minus 10. This is a word used in ophthalmology and in English, but it derives from the Latin word for nipple. All right. No one for plus 15 minus 10. Dash, the word that I'm looking for, is found in many parts of the body. The most well-known sites are duodenum, tongue, heart, and skin. Plus 10 minus 5, team B get plus 10. Team B are taking a chance and they also get plus 10. Team A, C, and E are waiting. Are you raising your hand? Are you waiting? Not sure. So we go for plus 5 for A, C, and E. In the eye, we see this in relation to the word that we are talking about. All right. C seems to have written an answer and they get plus 5. A and E have chosen not to answer. Audience? Papilla. Papilla is the word we are looking for. Papilla is the Latin word for nipple. Papillae are found on the skin, the conjunctiva, duodenum, tongue, and the heart. Giant papillae or GPC, cobblestone appearance, which was shown, is what we are seeing. So papillae was the connective word we were looking for. A round of applause for the two teams who got this right first. All right, so connect. Bilateral polygonish gray-white opacities, this is seen very well over here, all of these. In the deep layers of the Bowman's and the epithelium, it shares, let me complete the question, I don't want you all to lose 10. It shares the name with a large amphibious reptile. It also shares the name with an ophthalmologist. I want the ophthalmologist's name. If everybody is written crocodile, crocodile is not an ophthalmologist's name. We know ophthalmologists who look like crocodiles, but no, that is not his name. Minus 10 to team A. Anybody who they want to lose 10, they lose 10 either. They also lose 10. I saw a hand up and they also lose 10. So all three can cry our crocodile tears, but I clearly said there's an ophthalmologist who's described this term and it bears his name. What's his name? So all 5 get to answer. The next clue is that stem cells of the epithelium at the limbus are nestled within this structure, which also bears his name. Okay, team B are trying to get plus 10 here. Plus 10 to team A, they got the right answer. As did team D and team E. Both get 10. Okay. Are you showing me alt again? No, okay. Yeah. So all 5 teams have gotten 10 at this attempt. So I won't need to go to the next clue, but the next clue is, it is also part of an autoimmune condition that affects the eye, skin and hair. And the answer is Alfred Vogt, because it is also Vogt's anterior chagrin, not just crocodile chagrin, which everybody remembers. Palisades of Vogt and Vogt-Koyanagi-Harada disease. All right, oh, that was there. Okay, that was an audience question, but I think I'll move on in any ways. A lot of ophthalmic conditions like Retter's syndrome, vaginous granulomatosis are now changing their name. The reason now, of course, being that all of those work was done during Nazi Germany during the concentration camps using prisoners of war. So that was the question as to why they were being changed. Can we have the scores in the meanwhile, or are we still calculating? So while we do that, I can at least go back and get some rest and stand in a place for the next round. Next round is I think a buzzer round. It's a little fun. So before we go to the buzzer round, can we check if your buzzers are working? Team A, can you press your buzzer? Does it show there which team is answering? Okay, so I think. All right. So let me just see if team A, when you press your buzzer, does it show up? All right. So you can reset it. Team B. All right. Team C. Great. Team D. Perfect. Team E. All right. So the circuit is set up that only the first person who presses it lights up, and then any other button doesn't get registered. And then here, of course, what happens is you get plus 10, 15 for the right answer, minus 5 for the wrong answer, and it does not pass on, it goes straight to the audience. Okay. All right. So it's called Inhi Logone, because what we're going to do is show you logos of ophthalmic organizations, societies, etc., etc., etc. All set? Let's do a trial run to see how fast your fingers are working. First benchers, audience. All right. This is your logo. Okay. Team E. Into your mic.
Shankara Netralaya.
All right. So you got the idea and the mics are working. This was a test round. Shankar Netralaya is the right answer. I won't come to TNOA and put this. Although there are such similar questions, you won't believe the answer that you may actually get in this round. All right. So let's start. Fingers on the buzzer. Plus 15 minus 10 or minus 5? Minus 10. Minus 5. Okay, chalo, minus 5. No problem. Plus 10 minus 5. No one going for it? No one going for it? Any alumni here? AIMS is the right answer. This is the logo of AIMS, All India Institute of Medical Sciences. So we removed the name, you just need to identify it. Okay, this was tough, it gets easier from here, so don't worry. Next. Team B, audience, the audience needs to be a little more smarter. Y'all are being less smart by shouting out the answer. Team B, you need to answer into the mics. I won't say that again. Please hold your answers.
Abbott.
Abbott plus 15 to Team B. Audience, y'all are far more smarter than this, please. Next question is this. In which logo is this hidden? Team E.
NASA. NASA, no.
NASA. NASA is not the right answer. So this is a part of a logo of a product. Which product is that? In audience, you get to answer that. Retina surgeons, you may have seen this somewhere. So minus 5 to Team E. The answer is Ozurdex, and that's the implant going into the eye in the logo that's being used. So you were thinking out of space, we are thinking inside the eye. Huge difference. All right, next. So that's where the logo is hidden. Team B.
AAO.
AO, American Academy of Ophthalmology, has just random lines into the eye. It is correct. Plus 15 to Team B. All right, the next logo. Audience is already warming up and answering, but please try not to answer. Team B.
Appasamy Associates.
Appasamy Associates plus 15. So we are going hyper local. Team B is getting an advantage. Now we are also going to have some fun here. What drug is packaged like this? See, I knew it. Retina people will answer. Cornea people will answer. Lenses people, lens company people will know. Audience, oculoplasty, nobody will know. Botox is the answer we were looking for. Team participants should have known. Botox is the branding of the logo this way. The next question for the participants I expect a faster response time. Okay, Team D, tell me.
TNOA.
TNOA. You took so long to get that answer. And I'm just surprised that the other teams are all scratching their heads. So, of course, the logo was removed from, you see, it was at the bottom of every slide, but in this slide we removed that and just put this. And it was TNOA. It's, of course, there everywhere. And in spite of that, it took so long. If you had got it wrong, I'd have probably given you -100 and not -5. All right, next, fingers on your buzzers. Oh no, there is no next logo. So we have the scores ready for till now. All right, so we go in, Team A is currently on 55. Team B and Team E closely following at 70. Team C has taken a slight surge at 95. And Team Arvind, Team D, leading currently with 130. They have taken a strong lead. And I think now we go back for, what we have is the only round remaining, which is the rapid fire, I think. Yeah. Just give me 1 second. Fire is remaining. All right, so we start the rapid fire with the team lying fourth. So that will be Team A. Yeah, so the order for rapid fire is going to be Team A followed by Team B, then E, C and D. All right. So the rules for the rapid fire is very clear. We have 1 minute and we have 8 questions for every minute or every set in the rapid fire. Plus 10 for every correct answer. The first answer that I hear or the first answer that I hear will be treated as your final answer. There are no negative. So if you are unable to answer a question, you can pass, and if we have time remaining, we will come back to it. There are no negatives, so plus 10. So imagine you can make up a difference of 80 points in this round alone. It's possible that the orders can completely change. So Team 1, can you give me a timer of 1 minute? And when we say start, can you tell me when to start? I'll tell you when to start. All right, we can start. Team A ready? Mic close to you. You can pass when you want to come back and pass. And if you have the time, we'll go through that question. Your time starts now. Team 1, can you expand the term azure?
Acute zonal outer, occult outer retinal necrosis.
Is incorrect. Question 2, true or false, intracameral moxifloxacin shows no benefit in decreasing incidence of post-cataract endophthalmitis.
False.
Is correct, plus 10. What is this appearance called, not the diagnosis?
Symmetric boat, crab claw sign.
Is correct, plus 10. What disease did Ivan trial investigate?
ARMD compared ranibizumab and...
ARMD is the answer we are looking for, plus 10. Identify
RAF
this instrument, plus 10, RAF rule, which is the only FDA drug approved for increasing eyelash length and growth.
Dermatoprost.
Is correct, plus 10. Name this disease.
Sturge-Weber.
Sturge-Weber syndrome is correct. The most common field defect in non-arthritic AION.
Altitudinal defect.
Is correct, plus 10. You answered one incorrectly with 0 passes. You get plus 70. You get 7 correct? Yeah. outer zonal retinal, it was not retinal necrosis, it was retinopathy, acute zonal occult outer retinopathy. All right. An excellent rapid fire by team A. Team B. This is your set for rapid fire questions. Your time starts now. Expand MUDES.
Multiple evanescent white dot syndrome.
Plus 10, that's correct. True or false, the most common intraocular tumor is choroidal mets in adults.
True.
Is correct. Plus 10. With a history of trauma, you get this fundus picture. What is your specific diagnosis?
Pass.
If this is a condition, what would be your drug of choice be for infantile capillary hemangioma?
Pass.
What pediatric disease did the ATOM study investigate?
Pass.
Identify this used instrument or adjunct in surgery.
Pass.
In this angiogram, what structure is being pointed to?
Cilioretinal artery.
Is correct, so you get plus 10. With this fundus picture, give me a spot diagnosis.
Optic disc pit.
Is correct, you get plus 10 and time is up. You get 4 correct, which is MUDES, and your true and false for choroidal metastasis, cilioretinal artery and the disc pit. The answer we were looking for here was Monoca stent or mini Monoca. What pediatric disease does ATOM study investigate? Myopia. Drug of choice for infantile capillary hemangioma? Propranolol, and this is choroidal rupture. The audience has their game spot on. They get 40 for this round to team B. Team E. Ready with your mics? Your set of questions comes now. Time starts now. Expand APN PPE. Team E.
Acute. Pass.
What drug did Marina trial investigate?
Pass. Pass.
What is this instrument?
Copies lens.
Plus 10. True or false, studies have shown that pseudoexfoliation may have a genetic basis with LOXL1 gene being the faulty gene.
True.
Is correct. What surgery has been performed in this eye?
CARES.
Is incorrect.
Infrastromal.
How do we better know the drug VEGF trap as?
Aflibercept.
Is correct. Plus 10. This is an ultrasound of a 50-year-old which is bilateral, symmetrical with no trauma.
Pass.
In a fundus with this, what would be your diagnosis?
Pass.
This is an ultrasound?
Pass.
All right. So this is, what is the diagnosis for this, the audience? Myelinated nerve fibers, disc drusen, VEGF trap, aflibercept. This was intacs and not CARES. CARES is autologous corneal segments. This was correct. This was correct. Marina studied ranibizumab, and APM-PP is acute posterior okay, I can read it off. I don't have to. Acute posterior multifocal placoid pigment epitheliopathy. There was no way anyone was getting that, but that's the point of a quiz. The next set of questions is for Team C. Your 1 minute will start. Your time starts now. Expand GHPC.
Pass.
True or false, intravitreal injections are being used to treat retinoblastoma.
False.
Is incorrect. What disease did the CHAMPS study investigate?
Pass.
With these clinical pictures, what is your spot diagnosis?
Neurofibromatosis.
Is correct. Plus 10. This is an outdated lens, but what is it? What is the type of this lens?
Pass.
Vitracert intravitreal implant contains which drug?
Dexamethasone.
Is incorrect. What mode of imaging is this?
Specular microscopy.
Is correct. Plus 10. With this fundus picture, give me the diagnosis.
CSR.
Is incorrect. This was one that you passed. Can you identify this type of lens? All right. GHPC is geographical helicod peripapillary chorioatrophy or choroiditis. Melphalan, well, a lot of intravitreal drugs are being used to treat retinoblastoma. CHAMPS investigated. Optic neuritis. Neurofibromatosis was correct. These are accommodative IOLs, which are no longer being used. Vitracert has ganciclovir. Specular microscopy is used here, and this is Best disease or bullseye maculopathy would have also worked. So team D, your set of questions is coming here and your time starts now. Can you expand DUSN?
Diffuse unilateral subacute neuroretinitis.
Is correct. The most common intraocular foreign body found is iron particle or iron chips. True or false?
True.
Is correct. What substance or drug is injected intravenous prior to performing PDT?
Vertiporfin.
Is correct. Plus 10. Identify this
Farnsworth,
investigation.
Manson, Hansel.
Is correct.
Test.
Fanswell Munwat. Your diagnosis, please. I'll take one or two possible.
Optic nerve head. Pass.
Which disease was investigated in
Corneal
the...
ulcer. Herpetic corneal ulcer.
Is incorrect. I wanted herpes simplex
Stromal
first.
keratitis.
You lose, you don't get scored for this. What is this classic appearance called?
Smokestack appearance.
Is correct. What is the full name of this instrument with the handle?
Posner Susma.
Is
Pass.
incorrect.
Pass.
I don't think you have any other passes, so we don't have to wait for your time to run out. You got DUSN correct, iron particles correct, Waterporfin correct, Fanswell Munworth correct, optic disc melanoma or melanocytoma was what we were looking for. HED, heads, amongst multiple things, the simple disease that we are looking for was herpes keratitis. Smokestack is something that you got correct. This was simple Goldman's 4-mirror gonioscope that we were looking for. So you get 6 correct, 5 correct, plus 50. And we are working on the final scores here. All right, meanwhile, I have one question for the audience. All right. So, orbital retinoblastoma is typically classified as primary orbital retinoblastoma when it goes through the eye, extends to the orbit. Secondary orbital retinoblastoma where you've treated the disease, enucleated, and it comes back. Accidental orbital retinoblastoma where you've done an intraocular surgery and caused the disease to come out. Overt orbital retinoblastoma and microscopic orbital retinoblastoma, which the pathologist tells you when they occur. How do we know this classification system as? Oh, team A has known the answer, but I wanted the audience to answer this. Munawar? Yeah. So, who introduced this classification system and this classification? This system is called the Honauer classification of retinoblastoma, and it was in his landmark paper that he gave the description of each of these types of clinically found retinoblastomas that occur in the orbit after extraocular spread. And he's here in the meeting today, so do catch him, and he also has a session tomorrow in ocular oncology. While we've done that, we have the final scores ready. Are we just tallying? All right. So while they are working on that, I'd like to give a big round of applause to Dr. Bhuvana and Nandini, our scorekeepers for the day, who've given up 2 hours to stand here and do the scoring. Two minutes, all right. Even Lok Sabha election results come faster, but it's okay. Okay, so we have the results. Team E have scored 105 points. A big round of applause to them. Team B have 110 points. Team C have come up to 115 points despite being lower down in previous round. Team A have come to a high grand total of 125. But the winners of the Professor E.T. Selvam quiz at TNOA 2023 are Dr. Abhisha and Dr. Anusha Prasad from Arvind Eye Hospital and PG Institute, Coimbatore, with a grand total of 165 points. Congratulations. I think that brings us to the end of the quiz. Thank you so much for waiting and patiently being through this in spite of the OPL going on next door. Thank you. So can you give them names to